Hey guys, Dr. Kelly Yates here. I'm going to discuss the pregnancy and postpartum that we have here at Rehab to Perform. So follow me, I'm going to show you what that's going to look like. So this has been an awesome addition to our space, is our private treatment room. So this allows me the ability to chat with you, figure out exactly what's going on, if you've had any previous children, what that labor and delivery was like, your current status, how do you feel, what are your energy levels like if you're pregnant. Same thing postpartum. We know that's not an easy transition to make, so oftentimes we have to figure out where are we in that time of your life. After we get an idea of the movement screen and where our range of motion limitations may lie, we then look at strength. So that's going to involve not only just isolating certain muscles, but I want to see, how do you function? So can you sit down and stand up from a chair? Can you roll over in bed after having a baby, especially if there was a cesarean section? That's going to be greatly impacted. Can you pick something heavy up from the floor? Can you carry your baby? Can you comfortably breastfeed? I'm going to be looking at all of these things and having that discussion with you, again, to figure out which strength limitations do we have that we need to work on to make those tasks easier for you. After we look at strength and we figure out, okay, do we have any aches and pains anywhere? What limitations do we have? We'll do some more hands-on assessment to figure out, why are these issues occurring? Do we have any range of motions limitations more specifically than you just moving, how I ask you? Do we have anything in the areas of the glutes or the hips or the low back where those muscles might be tight that we need to work out? So during pregnancy, not to worry, you are able to go on your stomach here at Rehab to Perform, where we can assess the back muscles, the hip muscles, all of that with our awesome pregnancy pillow. After we then figure out, okay, this is what we need to work on, we're gonna come out of the private treatment room and start going over our exercises. So during pregnancy, it's actually been shown to be very advantageous to continue with exercise as you're able to. Now this might look different than before pregnancy. It's a different season of your life, therefore the exercises should reflect that. So I will help guide you based on what you like to do, what your goals are, not only during pregnancy, but postpartum. So our goals during pregnancy are to set you up for the postpartum phase. So anything I can do to keep you moving through that, keep you exercising, keep you and baby healthful during pregnancy, is then going to allow me to set up a better treatment plan postpartum and just have you in a better place for that space in your life. So let's go ahead, we'll show another tour of the full clinic of where that takes place. On this side, this is our new space. We have a bunch of tables over here that we can use if needed. We have turf space and a rig, so if we need to do a lot of stuff over here, we will. We also have the other side of the clinic that has a little bit more equipment. Again, depending on where you are in your goals, we may stay on this side, we may go to the other side. So let's head over to the other side of the clinic. All right, so this is the other side of our clinic. This is actually the original space here at Frederick. We also have a lot of turf space. We have dumbbells, kettlebells, rigs. We can do squat work. We can do deadlift work and keep you strong throughout both pregnancy and getting back postpartum for whatever sport or even just day-to-day stuff that you are interested in. Oftentimes we come out here to the turf, so I have a lot of clients who are interested in getting back into running, CrossFit, HIIT, all of that. So we do a lot of stuff on the turf to assess, especially in the postpartum phase, can we tolerate impact? So all of the activities that I just listed require the ability to tolerate impact. If we can't do that, we can have some issues with certain muscles up the chain in the pelvic floor and the hips that may produce some challenges of getting back to a sport you love. I utilize this space to start very entry level, and we gradually work our way up so you can confidently say, like, I'm ready to get back to these sports and I feel good doing it. So that is our ultimate goal as we work through these exercise programs. So we've talked about the evaluation day and what we look at for that and how we come up with a plan of care for you. Now let's discuss what each session moving forward will look like. This is for both during pregnancy and postpartum. You'll have 30 minutes one-on-one with myself. During that time, we'll address any hands-on work that we may or may not need to do to get those muscles prepped for our movement. After that, I will go through exercises that might be a little bit more challenging or require a little bit more coaching for you during that time and make sure that we're getting optimal movement patterns. At the end, we put you through what we call our circuit. So I'll write several exercises on the whiteboard for you that are either very straightforward or that you've done before and I know you do them well. And I say, all right, let's go through these exercises so that way we can see how you're tolerating our plan of care thus far. Prior to you leaving, I'd love to hear, how did it feel? Did anything feel like, that wasn't too good today? Maybe we need to adjust a little bit next time. The overall volume, what was that like for you? So it, again, allows me feedback so that I can change your plan of care if needed. So one question that I frequently get is, when can I come back to PT after I've had my baby? That can be anywhere from as short as 2 weeks to as long as 4 to 6 weeks. A lot of that depends on your comfort level. When you come back early, we assess, okay, where are we now after you've had your baby? How did that labor and delivery go? What do we need to work on? And it may not feel like low level at the time, but it's low level exercises, trying to get your brain talking to the abdominal muscles, the hip muscles, the pelvic floor muscles, and just getting that connection back. So early on, we're looking at that, and we're also assessing any type of incision that may have been done, especially if there was a cesarean. Make sure, is that healing well, so we can keep an eye on it. I oftentimes hear as well that we are told at the 6-week mark that you're good to go ahead and go back to exercise. I don't typically see that go well. So coming in a little earlier, or even at that 6-week mark, we then can discover, okay, what movement patterns, as we talked about before, do we need to work on to get you back into sport? And I will help guide you through that, so it's not going from 0 to 100 after having a baby. Here at Rehab to Perform, we believe in getting you back to whatever sport that is that you enjoy. And we want to actually see you accomplish those sports in here. So we will move beyond just exercises on the floor or on the table. That is an amazing start, and oftentimes that's what we need to do in the postpartum phase right after you've had a baby. Once we check some of those boxes though, I want to get you moving and I want to get you stronger as soon as possible. So that can look like starting with some body weight work. We might incorporate more breath work so that you learn how to appropriately use your abdominal muscles again. I then want to start to see, okay, can you do that under load? So can we add weight to it? If barbell work is your sport, if you love to get back into CrossFit, I want to work with you in here and do that. So we go far beyond table and floor exercises and really take you to the next level in that postpartum phase. So at the end of our plan of care, when we have finished our physical therapy and you are back to doing what you like to do, if you still want to continue to work with myself, we are going to be creating a pregnancy and postpartum track of our R2P Plus program. So that is online programming that we can help you virtually do stuff on your own, whether it's at home or in the gym. So stay tuned for that. But thank you so much for joining us. I hope you enjoyed this tour, and I really look forward to working with you all.